you are a traveler, this would be a great series for you to watch because I'm going to talk about a condition called motion sickness. Why should you listen to me? I'm board certified doctor here in the US, and me and my wife, we have traveled 65 countries. Hi everybody, this is Dr. Rakesh Shah from Life of Travel, and welcome to this series, Medical Tip for the Travelers. If you are a traveler, this would be a great series for you to watch because I'm going to cover all the common medical issues that you encounter while traveling, and I'm going to talk in a layman's term. I'm not going to confuse you with a lot of medical jargons, and I'm going to show you way to handle all those issues one by one in different episodes. So watch the whole series. Why should you listen to me? Well, I'm board certified doctor here in the US. I've been practicing emergency medicine since 2003. I started my medical college in India in 1986. So almost 4 decades of medical experience I have, and I did residency in India in the US. So I did double training, and me and my wife, we have traveled 65 countries as of April 2025. So we have an extensive travel experience also. So based on my medical expertise and the travel experience, I'm going to give you tips when you travel in a very simplified form. Now, I'm not your doctor, so this is not an official medical advice. So I won't be liable for anything that you do based on the videos, but this is a good faith medical advice that I'm going to give you. So for any specific medical question, you need to contact your medical doctors. Welcome to this episode number one, where I'm going to talk about a condition called motion sickness. That means the motion, either real motion or perceived motion, movement, and sickness. The sickness can include nausea, vomiting, dizziness, perspiration, headache, not feeling well. Those are the things that people experience. Now, all of us, when we get in the motion, have some reaction from the body, but those with the motion sickness, this reaction is too much and they cannot handle it. Just to give you a little bit of history about this word, nausea. Nausea. So naus means ship. Naus means ship in Greek. So nausea means something that happens while in ships. Next we'll talk about why it happens. Why do you get motion sickness? Normally we are able to maintain the equilibrium because we get the perfect input from your eyes, ears, and the sensations that we get when we are standing or sitting somewhere. These are the three main input that goes to the brain, and brain decides everything. But people who gets motion sickness, these three things are not in harmony. For example, if you're sitting in a cruise ship cabin, your inner ear, the balance receptor, or your touch will feel as if the room is stationary, not moving. But if you look outside, far away through the balcony, then things will feel like it is moving. So that is a disharmony between the input. And same thing, like if you are reading a book while driving, then all your three sensations are not in harmony, and that is how you get motion sickness. So next we will talk about who gets it. Female, they get motion sickness more than males. Age wise, less than 2 years kids, they don't get it. So it peaks around up to 9 years of age, and then it kind of keeps going down. And pregnant female, their chances of getting a motion sickness is high. There's some genetic component also, like if your parents had a motion sickness, you might get a motion sickness. Then if you have a migraine, then chances of you getting motion sickness is higher than other people. And then expectation, some people kind of expect ahead of the time, oh, I'm going to get motion sickness, and yeah, they will get the motion sickness. The other factor is, if it is a slow moving vehicle, like for example, cruise ship, you get actually more motion sickness compared to fast moving things like plane. If you're in the plane, chances of motion sickness is very low. You can get other thing, but not the motion sickness. Relatively, it's not like you don't get it, but less. And if you're horizontal, chances of getting motion sickness is less compared to vertical. So these are some of the kind of things that you have to keep in mind. So there are no tests to diagnose motion sickness. We just diagnose by history. Next comes is the treatment. There are ways to treat without medications, and there are ways to treat with medications. Now, the without medications, great, because you don't have to take any pill or any patch. But with the medications, you have to really make sure that you need that medicine, because what most of the medications we prescribe for motion sickness, what they do is we call sedating medication. So you're going to be sleeping through it. On one hand, you'll be okay because you won't have that dizziness and nausea and vomiting. But at the same time, you are on vacation, you are traveling, you won't be able to enjoy your travel. So unless your motion sickness is so bad that you can't do anything, then obviously you need to take medications. But before you jump onto the medications, I'm going to tell you a few things that you can do to prevent the motion sickness, because once the motion sickness starts, it is hard to kind of treat. You can still treat it, but better to prevent it than treat it. Now we're going to talk about the non-medication ways to minimize or prevent the motion sickness. First thing you can do, the moment you feel like you're going to get motion sickness, look way out there in the horizon or a stationary object. That will minimize your symptoms. And obviously don't read while the vehicle is in motion, and don't look at the screen because that's going to make your symptoms worse. For cruise ship, the best location for people with the motion sickness is midship and the lower deck. I know we all want to be at the higher deck, but for the people with the motion sickness, lower is the better location. And when you are in the car or any vehicle on the road, you should be facing the direction you are going towards, not opposite direction. And if possible, be in the front seat. If it is possible, be the driver rather than be the passenger, because that will minimize your motion sickness. And one more thing is acupressure. It's not proven, but if you press this area, this is called P6 area, which is kind of a 3-finger breath this way on your wrist on the inner side, and if you massage or press, this may help your motion sickness. So these are the ways you can deal with motion sickness without taking a pill or a patch. Now we will talk about the medications. Two main classes. One is a scopolamine, that is a patch you put behind the ear, and the other is a pill. So the scopolamine is mainly for the people who are anticipating longer journey. Like if you're taking 10 days cruise, that would be a good idea for it. But if you're just taking a 4 hours ferry, then antihistamine are good option. With both the medications, there are a lot of side effects, including dry mouth, blurred vision, urinary retention. So take only if you think that the benefit of taking the medicine is more than the risk, and consult your doctor. This is not a medical advice. Now with the scopolamine, it's a 1 milligram patch that you put around 4 to 12 hours before the journey begins, and you change it every 72 hours. And antihistamine like Dramamine or Meclizine, you take every 4 to 6 hours as needed, and start 4 hours before the journey begins. So you choose whatever is your journey time, and you can take it that way. Antihistamine causes more sedation, so you have to keep that in mind. And the other non-sedating antihistamines like Claritin, Zyrtec, Loratadine or cetirizine, they don't work on this motion sickness, so keep that in mind. What about people who do not respond to scopolamine or antihistamine? They can take medicine called promethazine, that is Phenergan, or they can take oral scopolamine. But make sure you consult with your doctor before you jump onto all those things, because every medication has got a lot of side effects. And if you're pregnant, obviously you can take Meclizine or Dramamine, but scopolamine you should avoid, especially if you have preeclampsia, which is high blood pressure in the pregnancy. But all those things, make sure you consult with your OBGYN before you put any pill in your mouth. And if possible, avoid the journey, because that is the best way to avoid the motion sickness while you're pregnant. So that's all about the medication treatment for motion sickness. Thanks for watching this, the first episode of the series Medical Tips for the Travelers on Motion Sickness. I'm sure you liked the video, so can you hit that like and subscribe button below, and let us know in the comment section if you had any experience with the motion sickness and what did you do to alleviate that. That would be great. And share the video with somebody who has a motion sickness, because they will really thank you, because they will get a lot of information from this video. And I'll see you in the next video in the series